Two divisions of the skeleton: axial and appendicular. Axial skeleton: the bones that form the longitudinal axis of the body. Appendicular skeleton: the bones of the limbs and the girdles. Skeletal system: consists of bones, ligaments, joints and cartilages. Functions of the bones include support, internal framework that supports the body, protection, soft body organs, movement, acts as levers to move the body and its parts, storage, fat, minerals, blood cell formation, hematopoiesis. Adult skeleton has how many bones? 206. Two major types of bone are osseous tissue. Compact bone, dense and looks smooth and homogeneous, spongy bone composed of small needle-like pieces called trabeculae and lots of open space. Four groups of bones: long, flat, short, irregular. Long bones, typically longer than they are wide, mostly compact, all bones of limbs, except the wrist, ankle bones, and patella. Short bones, cube-shaped and contain mostly spongy bones of the wrists and ankles. Flat bones, thin, flattened, and usually curved, most bones of the skull, ribs, and sternum. Irregular bones, bones that do not fit one of the preceding categories: vertebrae and hip bones, bones that have complex shapes with short, flat, notched or ridged surfaces. Examples are vertebrae that form the spinal column and several bones in the skull. Diaphysis, shaft of the long bone, composed of mostly compact bone. Purus ostium, fibrous connective tissue membrane that covers and protects the diaphysis of the long bone. Epiphyses, end of th long bone. Articular cartilage, covers the ends of the epiphyses, provides a smooth, slippery surface that decreases friction at joint surfaces. Yellow marrow, medullary cavity, cavity of the shaft, storage area for adipose tissue in adults. Red marrow, found in the cavity of the shaft of young bones, confined to the cavities in the spongy bone of flat bones and the epiphyses of some long bones in adult bones, responsible for hematopoiesis, making blood cells. Bone markings, bumps, holes, and ridges that reveal where muscles, tendons, and ligaments were attached and where blood vessels and nerves passed. Two categories of bone markings are A. Projections. Processes grow out from the bone surface. B. Depressions, cavities, indentations in the bone. How to memorize bone projections. All terms beginning with the T. How to memorize bone depressions. All terms beginning with the F except facet. Osteocytes. Mature bone cells, develop from osteoblasts, control day-to-day activities. Each occupies a lacuna, a pocket sandwiched between layers of matrix. Ossification. Process of bone formation. Osteoblasts. Bone-forming cells. Osteoclasts. Giant bone-destroying cells in bones, large, multi-nuclear cell that resorbs, destroys, bone matrix. Hypercalcemia. When blood calcium levels are too high. Epiphyseal line. In adults, remnant of epiphyseal plate. Epiphyseal plate. Growth plate, made of cartilage, gradually ossifies. Lacunae. Small spaces between the lamella which contain osteocytes. Central canal, Haversian canal. Runs parallel to the long axis of the bone and carries blood vessels, nerves, and lymph vessels through the bony matrix. Perforating, volkmann's canal. Second type of canals, lie at right angles to the long axis of the bone and connect the blood and nerve supply of periosteum to those in the central canals and medullary cavity. Canalculae. Small hair-like canals extending from the central canal, allow for diffusion of nutrients, waste products, hormones, etc., to lacunae. Organic portion of bone. 1/3 of the mass of bone, mostly collagen, gives tensile strength and flexibility to bones. Inorganic portion of bones. Mineral salts, 2/3 by mass, mainly calcium phosphates, responsible for bone hardness and its resistance to compression. Osteogenesis is the process of bone formation. Stages of bone formation. Hyaline cartilage forms first in fetus. Osteoblasts start to build bone in the center. By birth, bone replaces cartilage except at the epiphysis. Remodeling of bones. Bones continually are broken down and build up again. Osteoclasts remove worn cells and deposit Calcium in the blood. Osteoblasts remove calcium from the blood and from new bone. Human growth hormone. Source: anterior pituitary, target, liver and long bones. Function: release of glucose resulting in bone growth. Sex hormones. Hormones that regulate the development and functioning of reproductive organs and that stimulate the development of male and female sexual characteristics. They increase bone growth during puberty, which results in growth spurts that close the epiphyseal plates. PTH. Parathyroid hormones secreted by the parathyroid gland. PTH increases the concentration of calcium in the blood mostly by increasing osteoclast activity. Calcitonin. Thyroid hormone that tends to lower the level of calcium in the blood plasma and inhibit resorption of bone. Rickets. Childhood disease caused by deficiency of vitamin D and sunlight associated with impaired metabolism of calcium and phosphorus. Soft bones. Osteomalacia. Rickets in adults. Fractures. Any type of break in a bone. Reduction. Correcting a fracture by realigning the bone fragments. Simple closed fracture. Closed fracture does not pierce through the skin. Compound open fracture. The bone breaks and ruptures through the skin, which creates an increased chance of infection. Open reduction. Involves surgical exposure of the bone and the use of plates, screws, or pins to realign the fragments. Closed reduction. Realignment of broken bone ends without surgery. 4 stages of bone healing after fracture. 1. Hematoma forms. 2. Fibrocartilage callus forms. 3. Bony callus forms. 4. Bone remodeling occurs. Hematoma forms. Torn blood vessels tear and hemorrhage, blood clots called hematoma form, and sites become swollen, painful, and inflamed. Fibrocartilage callus forms. Step 2 of bone healing. New capillaries form. Blood cells carry away dead and damaged cells. Connective tissue comes together to make callus. Bony callus forms. New trabeculae form a bony, hard callus. Bony callus formation continues until firm union is formed. Until the 2 months. Bone remodeling. Dynamic tissue undergoing constant remodeling due to internal and external forces. Weight bearing and muscle contraction encourages stronger bone. Limited or non-weight bearing and bed rest decrease bone strength. Comminuted fracture. Fracture in which the bone is splintered or crushed. Compression fracture. Fracture in which the bone collapses, especially in short bones such as vertebrae. Depressed fracture. Fracture of the skull where the bone is pushed in. Impacted fracture. Fracture in which one broken end is wedged into the other broken end. Spiral fracture. A fracture in which the bone has been twisted apart. Greenstick fracture. A partial fracture of a bone, usually in children. Sinuses. Air spaces in cranium that lighten the skull and serve as voice resonating chambers. Fontanelle. Any membranous gap between the bones of the cranium in an infant or fetus. Intervertebral discs. Fibrous cartilage between vertebrae which provide shock absorption and flexibility. Herniated, slipped disc. A painful rupture of the fibrocartilage of the disc between spinal vertebrae. Vertebrae. 26 small bones that make up your backbone. Coccyx. The tailbones made up of the 4 fused vertebrae at the base of the spinal column. Sacrum. Wedge-shaped bone consisting of 5 fused vertebrae forming the posterior part of the pelvis. Thoracic. 12 vertebrae. Lumbar. Loin, waist region, L1 to L5. Cervical vertebrae. The first set of 7 vertebrae that form the neck is also known as C1 through C7. Atlas. The first cervical vertebra. Axis. The second cervical vertebra. Scoliosis. An abnormal lateral curve to the vertebral column. Kyphosis. Exaggerated posterior curvature of the thoracic spine, hunchback. Lordosis. Abnormal anterior curvature of the lumbar spine, sway back condition. True ribs. Top 7 pairs of ribs that attach directly to the sternum bicostal cartilage. False ribs. Last 5 pairs of ribs attach indirectly to sternum. Floating ribs. Last 2 pairs of ribs do not attach to sternum. Pubic arch. Inverted V-shaped arch inferior to pubic symphysis, over 90 degrees in females, and about 60 degrees in males. Arches of the foot. 3 arches are curves of the bones of the foot and ankle that, along with muscles and other soft tissues, properly support the mass of the skeleton. Flat foot. Defined as contact of the entire foot on ground. Fallen arches. Weakening of the tendons and ligaments supporting the arches of the foot. Joints. Areas where 2 or more bones join together, sometimes called articulations. Synarthrosis. A movable joint. Diarthrosis. A joint so articulated as to move freely. Amphiarthrosis. Slightly movable joint. 3 functional classifications of joints. 1. Synarthrosis, a movable. 2. Amphiarthrosis, slightly movable. 3. Diarthrosis, freely moving. 3. Structural classifications of joints. 1. Fibrous bones held together by collagen fibers. 2. Cartilaginous held together by cartilage. 3. Synovial held together by ligaments. Fibrous joints. An articulation in which the bones are joined together by dense fibrous connective tissue, lack a joint cavity, and almost no motion is possible. Types are sutures, syndmoses, and gomphoses. Most are synarthrotic joints. Sutures. Immovable joints between skull bones. Cartilaginous joints. Structural joints where bones are connected by cartilage. Amphiarthrosis joints such as pubic symphysis, intervertebral joints and intercostal joints. Synovial joints. Joints that are held together by a joint capsule and ligaments and are most associated with movement in the body, found in diarthrosis joints. Six types of synovial joints. Plane, hinge, saddle, condyloid, ball and socket, pivot. Plane joint. Short slipping or gliding movements, i.e., carpals. Hinge joint is found at the elbow, knee, ankle, and fingers, allows a joint to bend and straighten, promoting rotation. Pivot joint. Rotating bone turns around an axis, i.e., connection between radius, ulna and humerus. Condyloid joint. Synovial joint that does everything except rotating. Ball and socket. This type of joint allows circular movement and is found in the shoulders and hips. Saddle joint. A diarthrosis joint that allows rotation, thumb. bursae. Flattened fibrous sacs lined W. Synovial membrane, contains synovial fluid, common where things rub together. Bursitis. Inflammation of a bursa. Osteoarthritis. Most common form of arthritis that especially affects weight-bearing joints, e.g., knee, hip. Characterized by the erosion of articular cartilage. Rheumatoid arthritis. A chronic autoimmune disease with inflammation of the joints and marked deformities. Something, possibly a virus, triggers an attack on the synovium by the immune system, which releases cytokines that stimulate an inflammatory reaction that can lead to these deformities. Gout. A painful inflammation of the big toe and foot caused by defects in uric acid metabolism resulting in deposits of the acid and its salts in the blood and joints. Osteoporosis. Abnormal loss of bony tissue resulting in fragile porous bones attributable to a lack of calcium. Gigantism. Condition brought about by overproduction of growth hormone by the pituitary gland before puberty. Dwarfism. Condition caused by insufficient growth hormone in childhood.